Dr. LeBlanc, I would like you to tell me a little bit about what's up with sleep apnea. I have heard lately that there are lots of people having sleep apnea, and many people who have sleep apnea, actually almost all people who snore have sleep apnea, not necessarily all, and that there are ways, and because of it, people have started falling asleep in the afternoon. They have basically a lowered level of energy, which makes sense because they stop breathing and they never go into deep sleep. And there seems to be two ways of fixing it. One, which is with a CPAP machine, an oxygen machine, which works very, very well, but is very, very uncomfortable. And the other one is a dental mouth guard or something like that, which works maybe not quite as well as the oxygen machine, but is very comfortable to wear. Those people do wear it. Shed some light on it.
Well, you've said most of it already, but I'll just recap. Yes, sleep apnea tends to be quite widespread, and it's simply that when you're sleeping, your airway closes too much. So snoring is an indication of it. Worse than that, people just waking up out of breath. People not getting a good night's sleep, like you say, they're just tired all day long, and they go to their doctor, and the physician will say, well, you might have sleep apnea. I have many patients that have tried the machines. Some can tolerate, some can't. You have to sleep a certain way. They are much more uncomfortable. So then it boils down to, would a simpler and much less expensive alternative make it where your airway was open enough to breathe, and thus you wouldn't have the problem anymore. And that's a simple appliance. You come in, we take impressions, we send the impressions of your teeth and your bite record, the record of your bite, to the laboratory, and a week or two later we get back the appliance. You wear the appliance, and all the appliance does is position your jaw in a way where it keeps the airway open. If the airway's open, you can breathe. If you can breathe, you're not going to be snoring and waking up out of breath.
Okay.
So rather simple.
Right. So there's basically two things. Most of the time, spouses have a problem with the other person snoring. It wakes them up, to a degree that sometimes they have to go to different rooms, and that's just not the way they planned it. But then there's the fact that people, they said that there's more people having car accidents with sleep apnea than there's people drunk driving, and that's pretty bad. And there's of course the fact that you're tired and exhausted throughout the day, and all that stuff. They even that's the real bad thing. So let me ask you, when a person kind of doesn't sleep, and then now he gets this appliance from you. You said it's a lot cheaper and a lot more comfortable. Does it last for a long time? Does he have to go there very regularly to the dentist and keep getting the appliance, or is it one time an appliance which lasts for years to come, or what's the deal there?
Yeah, generally they last for years. It's a sturdy appliance. So yeah, there's no question compared to the machine with the oxygen. It's much more costly and it's much more comfortable. You mentioned earlier, is it more effective? It probably is more effective. So the only way to figure that out for an individual is to try the appliance. If the appliance works, then they don't have to go with the machine.
And should a person?
But there's no way of knowing that without trying it.
Right. Should a person go and do what's called a sleep test, which is relatively expensive, or like some people tell me, well, you can't do it, and they will tell you that instead of 7 to 8 hours which you sleep, you really only sleep a couple hours, and you stop breathing sometimes 8 to 10 to 20 times an hour, or if the person says, look, I wake up exhausted, I have this afternoon urge to need coffee or Red Bull, or just feel like falling asleep, and I have things like that going on. Does that, they even say that, people who go to the bathroom throughout the night, one of the reasons is they sleep so light that little pressure which comes on makes them feeling like it's the bathroom problem, when it really isn't. They sleep so light. But the point is, do they have to go to that sleep? Or if they have those symptoms, just go and get the appliance. And if you then feel better, which you probably will, especially if you snore, it's all done. No need to measure it, because the real measurement is, do you feel better?
Yeah. Well, there certainly wouldn't be any huge negative to, getting a thorough evaluation. But it's, number one, it's not fun. My dad went through it. And number two, it's very expensive. So what would be the negative of just trying an appliance? Well, there really isn't a negative. That makes a lot of sense.
Especially if you snore, because you probably want to get rid of the snoring if you have a partner anyway. If you don't have a partner, maybe the snoring doesn't bother anybody, but...
Right. But they're really, how can you think of a negative of trying the appliance? I can't. It makes a lot of sense to give it a try.
A few $100 maybe, but I think that outweighs just about everything these days. To just have a little bit more energy. For all purpose.
And especially since it is effective for so many people. This isn't new. This is something we've become aware of for at least a decade, maybe more. But it's widespread, common knowledge, if you will, for at least a decade. So it's not new, so we know that just a simple advice helps a lot of people.
Yeah, well, the appliance isn't new. It's good that you mentioned that. But what is new is that the medical establishment starts realizing that people being depressed, exhausted, falling asleep on their wheels and on their jobs, and just basically being lifeless. And by doing so, well, you know what lifelessness means. It's just not fun. That comes from sleep apnea. And
don't forget, Helmut, wives hitting you with pillows.
So I must be not snoring all that bad, because I haven't gotten a bill for ever.
That's no fun either.
Okay.
Yeah.
Well, all right.
Yeah.
Let's get a device. Thank you very much. Bye-bye.
All right.